Welcome to Kitchen Table Finance, the podcast where we serve up bite-sized pieces of financial advice to simplify your money and your life.
Hello and welcome to the Kitchen Table Finance podcast. I'm your host, Nick Nauta, and unfortunately, we are without our co-host, Mr. Shotwell, today, who is probably up north in the woods somewhere, if I had to guess. But good news for everyone else. We have the wonderful Justine Bell with us today from BeneGuides, and she is going to answer all of our questions about retirement, health insurance, and all the fun stuff that I never want to have to learn or know. So welcome to the show, Justine. Thank you for being here.
Thanks for having me. I'm excited. I love health insurance. I know it makes me a total nerd, but I love this stuff.
I'm just glad there's people out there like you. So tell me, why don't we start off by just telling us a little bit about how in the world you got into the wide world of health insurance and why someone would choose to go down this path.
Absolutely. Well, we always joke that none of us were putting on our princess dresses and thinking, you know what I really want to be when I grow up is a health insurance agent. My background is in nonprofit. And anybody who spent an amount of time in the nonprofit sector knows that it can be really difficult and it doesn't pay very well, which is the people who are still doing it have all of my support and love. But it just wasn't the right choice for me. And when Harrison, my son, was born, the amount that I would have had to pay for daycare was more than the amount that I was making per hour. So I needed to make a change. I always joke that I had to go find a big girl job. And so I started in P&C insurance, which is like business coverage, but it just really didn't have the same, it didn't feel like I was helping in the same way. I didn't feel the same drive and connection. And then people started saying, well, I don't really need help with that, but I have so many questions about health insurance. So I went and I learned and I studied and I found mentors and we added. And now we are a staff of 6 full-time employees doing nothing but health insurance. One of the things that I love is that people usually come in really stressed because everybody knows that health insurance is expensive and a little bit scary. And so we get to help sort of calm people down, make that connection, get all their questions answered, and make sure that they feel confident when they leave, which is gives me that same feeling of being a part of a nonprofit, but I actually get to make a livable wage, which is nice.
Yeah, that's awesome. So it's interesting because there's not like a school for health insurance, right? I mean,
No.
I assume, because I know that some of the schools, even in Michigan, there's some really good schools in regards to like an insurance degree. I'm sure that's not what they call it, but I'm sure it's something more along the lines of risk management or something cool like that. But you really don't there's not a hey, go to school, become a health insurance agent, go do this thing, right? So how did you find all those resources? How'd you get to where you are today?
So one of my friends was in insurance when I started looking around for my big girl job. You're totally right. You need a license to do health insurance. And then I've taken some additional courses. So I actually am a fellow of Health Insurance Advanced Studies. So you can trust me. I had somebody who was in the insurance space and he said that he thought it was something that I would be good at. And I think some people are sort of born knowing what they want to do. You hear those stories where they're like, I always wanted to be a doctor. And so I studied and got into med school and I did it, all the things. But for me, I just knew that I wanted to help people. And I didn't know exactly what that looked like. And so then finding this was perfect because I get to feel like I'm helping people. But you're right. It's not the sort of thing. It's the sort of thing where I sort of edged sideways into it and then liked it and got deeper and deeper. But I think that no matter who you are, finding mentors is so helpful. So when I'm an expert in my field. And then whenever there's something that is not in my field, I find an expert like you where I don't need to know those things. I can send people your direction so that I don't have to answer those questions. So just looking for relationships with the different companies, sitting down and asking what kind of questions are people going to ask me and how would I answer them, and even practicing conversations that I might have, that sort of thing, and then going out into the wild and seeing how it felt and just really loving it.
Yeah. So what is it specifically about health insurance and helping people with health insurance that you love? Like what draws you back to doing it day over day and now expanding your team and helping more and more people?
For me, it's like doing a crossword puzzle.
Mm,
And so what it is you have the same plans, right? Like you have, say, 50 plans that you can give to somebody, 50 potential plans. And then you have to work with them to find all of their clues.
yeah.
So you talk about prescriptions, you talk about doctors, you talk about lifestyle, you talk about goals, and all sorts of different things. We touch on a lot of different things when we're working with someone. And then that gives you the clues that you need to fill in the puzzle. And then when I was a kid, I thought I might want to be a teacher, but the thought of 30 screaming children is terrifying, like props to teachers. And so in this way, like once I solve the puzzle and figure out what I think is the answer, then my next job is to communicate it to you in a way that where you feel like that's the answer too,
Mm,
right? Because maybe there's something I've overlooked, or maybe I can't know you the way that you know you. I can do the best that I can, but my job is to educate you to the point where you feel like you're the one making the decision because you
yeah.
are.
Right.
And then you can feel confident walking out knowing that you made a decision that was right for you, and also that we're here for you if you need support throughout the year.
Hmm. Yeah, I imagine that one of the hard parts about health insurance is it's really, and truthfully, any insurance, it's like trying to project and predict what's going to happen, right? Like,
Mhm.
what do we want to insure against? What could possibly happen? What's likely to happen? And are we willing to put money aside? Are we willing to pay for the not to have to worry about certain things, right?
Absolutely. Absolutely. I think that one of the things we often talk about, I would say in almost every appointment, is average year and then worst case scenario, right? So
Hmm.
we talk
Yeah,
about like normally you go to the doctor 3 times, you see 2 specialists, and you have an ultrasound, right? And so we can add those numbers up and we can say, okay, on this plan, this is how that would pay what you would expect. And then we also talk about like what is your total risk, and is that something that you can absorb? Because the more risk that you're willing to take on with almost any insurance, the less that you have to pay. And so if you're generally
sure.
healthy and you can afford to mitigate that risk if you need to, then a bronze
Hmm.
plan is almost always the best.
Yeah,
But there are situations, especially prescription drug situations, where a bronze plan maybe doesn't make sense, and we want to do a step up. And so, yeah, it's a math puzzle every single time.
sure, sure. What would you say makes you stand out from your competition?
We haven't found any other agency so far that does what we do. And I think part of that is because we sort of grew it ourselves. Like we didn't have
Hmm.
something to point to say, this is what we should be doing. This is what is the standard. So we re-enroll every client every year. And what that means is that you never have to make a health insurance choice without us there next to you.
Yeah.
And we're a little annoying about it, if I'm being honest. Like we send a mailing, and then we send an email, and then we call you, and then we send another
Hmm.
email, and then we call you again. So if you've dodged us 5 times, then I feel like we've done our due diligence.
Yeah,
But we want to make sure that we're trying to reach people in a variety of ways, so
sure.
that we can and meet them where they are. But with marketplace coverage, in the amount that you pay can change based on your income. And so it really is important to make sure that we're keeping your income accurate. And with
Yeah.
Medicare, most people on Medicare have prescription drugs. And those change what's called a formulary, which is the list of covered drugs from the company. Those change significantly year over year.
Hmm.
And so I don't rest easily unless I've rerun all of the numbers, to make sure that everyone is in the best plan for them. And so we do that with all of our clients. And so far, I haven't come across another agency that like forcibly almost does
Yeah.
that with their clients each year.
Yeah. Well, I love it. And I think it's so important because, I mean, I'm just blown away at the number of changes that I see from year to year in the different insurances. Just health insurance in general seems like it's always changing. Then you complicate that if you're talking about the marketplace or Medicare with all of the changes from the tax code and things like that. It's like, it's a brand new, and you're using your analogy, it's a brand new crossword puzzle every year, right?
Exactly. Yeah. And your clues can change too. So like you might have had a prescription last year that you don't have anymore or vice versa. You
Right.
might be retiring and you want to spend 3 months or 4 months in Florida. And so then we need to have a plan that can support you in two different places.
Yeah.
And so, yeah, I'm keeping an eye on regulation is always an issue. And then making sure that we're having those conversations and that people feel safe telling us the things that they need to tell us. So for
Mm,
instance, we'll have a lot of conversations about, for instance, maybe mental health drugs or blood pressure drugs, all sorts of things that people maybe feel a little bit of shame
sure.
acknowledging. We work really hard to be approachable and open and a safe place for people to talk about those things because I can't do my job unless you're willing to tell me those.
Right.
And so, staying away from shame, making sure that we're very open with our clients, that they feel like they can talk to us is something that's really, really important here.
Yeah. Well, and I would say too, and obviously we've sent several of our clients over to you, and I'm always surprised at the number that are like, we didn't even know like that was an option. Like we just thought we had to go on the internet and do this thing and sign up for something completely blind with no idea of like what they were choosing or why or what the ramifications were. And would you like to talk a little bit about like how that works when someone works with you? Is there price differences? Like how does that piece of it work?
Absolutely. There's no cost to work with us in the same way that there's no cost to work with your home and auto agent. Same model. And so reaching out to us, having a conversation doesn't cost you anything. Enrolling with us doesn't cost you anything. You certainly can do all of the things that we do on your own. So you don't have to talk to us, but we constantly keep that bird's eye view of what's going on in the market, what's going on with the companies, who's closing, who's got good customer service this year, all of those pieces. There's no cost difference to work with us. So your cost doesn't change whether you enroll with us or not, and do it on your own. And then also, when something happens, I always say that we don't earn your business when we sign you up because that's easy to do. You could do it on your own. We really
Sure.
earn your business when something goes wrong because when
Mm,
we call a health insurance company, when you call a health insurance company as an individual person, you are one person, right?
yep.
And hopefully they're going to do the best that they can for you as your single person. But just in case they don't,
Yeah.
when we call the health insurance companies, we're calling with 500 voices or 1,000 voices, right? Because if
Hmm.
they don't fix the thing that we need them to fix, then we have the opportunity to move a much larger percentage of people. And
Sure.
so, fortunately, unfortunately, sometimes we can get things to move through the system in a way that an individual can't on their own.
Yeah.
Um, and so I think that that's of value too, right? So it's not necessarily the sign up itself that brings the support. It's when you have a problem mid year and you need somebody to be there with you. Like we are always there with you.
Yeah. No, that's super helpful. I haven't even thought about that, but just the fact that you guys have the knowledge of like, hey, we've worked with all of these plans and we can tell you which ones are easy to work with and which ones aren't, and which
Hmm.
ones you're going to have trouble with, because that's such an important piece of this whole thing of like the, especially if you're in retirement, the last thing that you probably want to do is spend 12 hours on hold with your health insurance company trying to figure something out, right?
Yep.
Your time is
Absolutely.
very valuable and can probably be used in several different better ways. So to have a team of people that can help you walk through that, I think is super important. So I'd like to talk a little bit about retiree health insurance since I've got you here. Let's start with, if this, we've talked about a little bit, we've alluded to it, but marketplace insurance, which for a lot of people who retire before age 65 and don't have Medicare, right? And then they have options once they retire. Can you walk us through what those options are and what that might look like?
Absolutely. So when somebody comes to us and asks about marketplace insurance, we're asking the same 5 questions. The first one is what is your zip code and county? Because everything is based on, it's all county by county. So that's the first information that we need. The second one is we're going to ask you the ages of anybody who's on your tax return, and then anybody who needs coverage. Sometimes, most often, those are the same. But there are a lot of situations, for instance, if you have a couple where maybe one of them is offered retiree coverage and the other one isn't, or maybe someone was in the military and they have VA coverage and the other one doesn't. So we're going to ask you ages, and then we're going to ask you who's on your tax return and who needs that coverage. The next thing that we're going to ask is we're going to ask about your health background. Knowing what an average year looks like for you is really valuable for us. You can say, I never go. You can say I'm hospitalized 3 times a year, right? Like there's a very wide range there. And we're going to ask about your prescription drugs and your doctors, providers. So doctors and prescriptions. And then the last thing, and this can be a difficult thing, and you and I work on this a lot with your clients, is marketplace coverage is based on income. That's MAGI. And so we're going to ask you what you think your estimated income is going to be for the calendar year that we are looking at. So right now, if you were asking about 2026, we'd ask you what your 2026 income would be. If you needed coverage for November and December, we'd ask you about 2025. And then because that can be kind of a complicated question, if that's a difficult thing to get to, then often, first of all, we'll walk through it together. So what's your Social Security? What's your pension? All these pieces. But if that's still difficult, then we'll do what we call a min-max, where we'll say, okay, it's not going to be less than X and it's not going to be more than Y. And then we'll run both of those scenarios and sort of find that middle ground to see what makes sense. There's a lot of anxiety, I find, about the income piece. And one of the things that people seem to learn that makes them feel better is that can be changed during the year, even if your plan cannot. So if we make a guess in January, and then it turns out that I have a funny client where they're retired, but he keeps taking on jobs and she keeps him. And so at the beginning of the year, he'll be like, I'm not going to do it. I'm not taking on any this year. And then they'll call me in March and they'll be like, we did it again. We'll adjust income, which is fine and easy to do. And then at the end of the year, when you file your taxes, the amount that we guessed for your income and the amount that you actually made are compared. And then you either get money back or you pay money based on what the difference is. So if we get it right on the money, if we literally right on the money, then you don't pay or get anything. But if we guessed a little high and you come in a little bit under, then you get some money back when you file. And if we guessed a little bit low and you went a little bit higher, then you can owe money back.
Another one of those great jigsaw puzzles. And I think the interesting thing when it first came out, and I think the thing that surprises a lot of people is it has nothing to do with like what your net worth is. So you could have $10 million in the bank, and if your income that you show on paper, what you're paying taxes on, is still low, you can qualify for these. And so some of the work that we have done together with you is figuring out like, what are your income sources? Does it make sense for us to take from something that you've already paid taxes on so it doesn't show up on your tax return, so that we can keep your income artificially low and qualify for some of those subsidies? Because we're talking about pretty decent size monthly subsidies potentially, right? What are they, up to like $900 or something like that? I don't know what the top range is. Higher. Yeah. So,
I would say but $1,500 to $2,000. Especially when you're nearing that retirement age, because that 55 to 64 is the most expensive time.
Oh, sure. Yeah.
And speaking of things that I don't ever want to do, like I love that I can call you and be like, hey, here's what we want. Can we do this? And then you're like, yeah, we got it. It's fine.
For sure. Well, we're a good team then, because we love doing that stuff and running tax projections and all that fun stuff. Let's talk a little bit about what happens when we turn 65, other than the fact that your mailbox gets flooded with flyers. What does 65 health insurance look like?
So 65 is generally Medicare. There are
Mm-hmm.
some other situations where you can get Medicare, but for an average person, they get Medicare at 65. Um, we have what we traditionally do with our clients is we bring them in for something we call a Medicare 101.
Mm-hmm.
And we go over original Medicare in a basic and understandable way. And then we'll go over Medicare Advantage and Medicare Supplement. We'll talk about the differences, pros and cons. Some people come in feeling like they know what they want to do. And so in that situation, I will say, well, do you want to go through this process? Because I won't force you to learn anything you don't want to learn. But most people agree to it. And every once in a while, we'll get somebody who's like, I was sure I wanted this type of plan. And now I'm like, I just didn't know this information about the other type. So I think it's a really valuable thing. And
Sure.
to a person, I have always gotten good feedback on it. So, like people coming in and saying, I feel like I had no idea what I was talking about, what I was in for, and then I left feeling a lot more confident, feeling like I know how things will work, which is really lovely to hear.
Yeah. Yeah. Well, I will be a testimonial to that because I don't know if you remember, you came and did a webinar for us on Medicare 101. I know I learned a lot of stuff. And it just so happens, I'm pretty sure we have that video still. I think it's up on YouTube. So I'm going to find it and put it in the show notes for us. But highly recommend that. Unless, of course, you have a more updated one that you want to share with us, we can put that in too.
No, I mean, we haven't really changed it a lot. Like we found our formula, I think, and then we'll make small tweaks, but in general, like the information is the same, even if the numbers
Yeah.
change.
Mm-hmm.
And so I think it's really withstood the test of time, which is nice.
Love it.
Yeah.
So making that Medicare insurance, well, I guess let's take a step back because we always get a lot of questions and confusion around when do I actually apply for Medicare? And especially as it relates to I turned 65, I'm still working. Do I need to apply for this thing? How does that work?
Yeah. These are good questions. If you are already on Social Security, you don't need to apply for Medicare. You will just get a card in the mail. It's an automatic process that happens.
Yeah. Okay.
So that's handy.
Yeah.
If you are not on Social Security yet, which I imagine most of your people aren't, which is fine, then applying for Medicare is an active process, and we can help you with that. We can either do it in person or we've done it on Zoom as well, where you log in and share your screen, and then we can walk you through that process. That begins 90 days before your Medicare start date. So, for
Okay.
instance, if you were turning 65 today, then we would start that process in June.
Mm-hmm.
We always try and start early because we tell people 75% of the time it is easy and smooth and not a problem at all. And then 25% of the time somebody drops the ball somewhere and we spend 3 whole months trying to figure out where that happened. And again, we're here for you if that does happen, but like we always try and start early. If you turn 65 the second or after, then your Medicare starts on the first of that month. So if you turn 65 today, then your Medicare start date is 9/1.
Okay.
But if you are one of the lucky people that turn 65 on the first of the month, then your
Uh-huh.
Medicare starts the previous month. So
Okay.
if you turn 65 September 1st, then your Medicare started August 1st, which means we needed to start that process in May and not in
Okay.
June. So it's a weird thing that
Yeah.
happens, but it is what it is. And of
Mm-hmm.
course, what we do is we bring you in at that 3 month mark. We do the Medicare 101, and then we also help you sign up for the Medicare through SSA.gov if you would like us to. If you are still working and you have an HSA plan, we wouldn't necessarily recommend getting Part A.
Mm-hmm.
Because getting Part A makes it so that you don't qualify for HSA to put HSA money into your
Yep.
HSA account anymore.
Mm-hmm.
If you are still working and you don't have an HSA account, then Part A is free and provides some liability coverage. And so
Okay.
you might as well.
Yeah.
And then we will help you apply for B when it's time for you to retire.
Gotcha.
It's a lot. Again, you ask what feels like a simple question, and I feel like I talked for 6
Right?
minutes straight, which is fine.
Well, I think that's why people get so confused, myself included, because there's so many different dates, so many different time frames, so many different scenarios. And what I concluded was call Justine. She'll figure it out for you. uh, so, is there a reason for? I mean, I know you went over the whole HSA thing, which makes sense. But is there other reasons why someone would or wouldn't want to apply for Part A if they were employed? Are there conditions where you're required by your employer to enroll, or how does that part work?
No, in fact, your employer can't require that you enroll in Medicare, which is great. One of the getting into Medicare versus retiree coverage, there really isn't a safe blanket statement to make because everything is
Yeah.
a little bit different. It's one of those where if somebody calls and said, "Hey, I still have employer coverage. I have access to Medicare. What should I do?" The answer is we should talk about it, right? Because the amount that you pay matters, your deductible matters, your maximum out of pocket matters. Because if you're paying more than $300 a month, I can almost guarantee you that I can get you a better plan for about the same or less, right?
Okay.
But if you're paying $50 a month or $0 a month with a plan with a $0 deductible and $1,000 maximum out of pocket, like stay there, stay there forever, right?
For
And
sure.
so that's one of the spaces where the answer is always, I need more information. And so
Yeah.
it's never a problem to like let you know what I need, and then we can compare things. We do that all the time. But there's no like rule in that space.
Gotcha. Okay. Cool. The other question that I always get people panicked called after the fact is there a penalty if you don't sign up for Medicare at 65?
This is a really good question. And the answer is as long as you have other qualified coverage, no, there is no
Okay.
penalty. So, say you have retiree coverage, you're with the state of Michigan, we know it's qualified, there's no penalty. If you just choose not to have health insurance, then yes, there is a penalty. And Medicare does a really interesting thing where it splits things into Part A and Part B, and then you have to add prescription drug coverage on it. And so, if you don't have prescription drug coverage, you can also start accruing a penalty there. To date this year, there's always been a $0 prescription drug coverage plan. And so, there's really no reason not to have it,
Yeah.
right? Because it's free.
Right.
And so you might as well just, even if you're not using it, at least you're avoiding that penalty. So I think, have never let anybody out of here without a prescription drug plan if they needed one.
Yeah.
But there have been times where we've sat down with people and said, "Hey, like, I get that you're not on any prescriptions. I totally understand that. And do you have to sign up for this? No. But if at any point in the future you get prescription drugs and you want a PDP plan, you're going to have to pay a penalty for it. So, like, let's hook you up with this $0 thing. And that way you just have that protection."
So I want to go back a little bit and talk briefly on the whole supplemental Medicare, Medigap, and Medicare Advantage, right? Those are the two big ones.
Yeah, way to go, you.
See, I listen. So I know it just seems to me like there's so many choices out there that people get overwhelmed. Like I said, they start getting flyers. Like, what
Yeah.
are some of the basic things that people just need to kind of think through and when making that selection, if they're not going to call you, which, if I'm being honest, I think they should just call you and let you walk them through it. But.
I mean, it's free, right? And so, like, it's not, I promise it's not a waste of time. This is a really good question. One of the really nice things about Medicare is it is almost always less expensive and better coverage. I can count probably on one hand the number of times where it was either more expensive or the coverage was worse. And so part of that is because you have paid into Medicare for your working life. And so
Yeah.
a lot of it is getting subsidized in a way that you just haven't had happen before. And so it is very, very good coverage for very little. And then when we look at One of the things that we talk about in the Medicare 101 is we talk about the pros and cons of each style of plan. And there is not a clear winner. Now, if you never go to the doctor and everyone in your family passes away in their sleep at 120, you should be on a Medicare Advantage plan because you're not paying anything per month to have that, and the chances of you needing it statistically are lower.
Right.
If you're hospitalized 6 times a year, you should be on a Medicare supplement plan. But anywhere in that middle space, you could go either way. And we joke that I would be much better at my job if I had a crystal ball and I could tell you exactly when things were going to happen and how much they were going to cost.
But you and me both, Justine.
Right? But when you do the math, because I love the math comes out about the same for an average life, which is great, right? So if you pay into Medicare supplement, then you pay more per month for the rest of your life. But when surprise things happen, you don't have to really worry about them because you have a Medicare supplement plan that's going to take on that cost. With a Medicare Advantage, you don't pay an additional fee per month, which is great. And then if you're, let's say you have a health issue every 5 years or so, even if you hit that maximum out of pocket, the amount that you saved by not having a Medicare supplement plan, really the math comes out about the same for most people, which is cool. So then really what it comes down to is personality style. And then we'll sit down and talk to you about which personality style you feel like you are, and therefore which plan is maybe a better match for you.
Gotcha. Okay. Just made me think of another question as you were talking about your example of your retiree who kept going back to work. You're over 65 and you're on Medicare and you have one of these plans, and then you go back to work and get coverage through work. Can you switch back and forth? Is that not allowed?
So technically, this is one of those questions where can you and should you, right? So can you? Technically, yes. But the government doesn't have a great way to turn off Medicare. Generally, they assume that once you get it, you're going to keep it. And then once you, let's assume we can get it turned off, then getting it turned back on again can be really complicated. So I generally recommend just keep paying B if you can. Just leave it there. You don't need the extras. You don't need the prescription drug coverage because you have other qualified coverage. But if you try and cancel B and then try and bring it back later, you're going to spend 20 hours trying to get that done. And so at that point, is it worth it? And then I let people decide if they think it's worth it.
Fair enough. So there's been a lot of talk in the news about potential changes coming to some of these retirement health insurance options. What do you see coming down the pipeline in 2026?
It's wild. It's going to be very interesting. So there was a bill that was passed a handful of years ago in regards to COVID. And one of the things that it did is it increased the rate reductions on the marketplace a significant amount so that people could get health insurance if they needed it. And that is set to expire at the end of this year. And I think no matter what side of the aisle you're on, there's just a lot of chaos at the financial or at the federal level right now. And so, for instance, the training that we normally do for Marketplace, which should have been out a month ago, isn't out because they don't know what's happening with that yet. And so, I think that it would be lovely if we can keep those rate reductions. I think it's going to be a rougher year if they get rid of them by a significant margin. And so it sounds like there are conversations happening about that because they haven't released any training yet because they think they don't know the answer. And so, and there are what would have been federally mandated changes that have been held back by the courts. So it's a really interesting year in regards to what the rules are. And we're, things change from day to day. So we're keeping up on it to make sure that we're giving the best information that we can. And hopefully everything will be settled by the time open enrollment actually opens so that we don't have to re-enroll people if plans change, if rules change. It's most certainly a complicated year. One of the things that I can say with certainty is that maximum out-of-pockets are going up, costs are going up.
Sure.
And so with a lot of change comes the moments where you should probably review your policies, whether it's with us or with someone else.
Right. Absolutely. Remind me again, when is open enrollment?
For Medicare, We are allowed to start talking to people about plans on October 1st, not before
Okay.
then. And then we are allowed to make changes to plans starting October 15th. And then
Okay.
Medicare open enrollment goes through December 7th. So it's a total of
Gotcha.
68 days. We have it on our calendar.
I bet.
And we re-enroll all of our clients every year. And so we have back-to-back meetings all day. If we have an empty space, we're making phone calls. Like it's an intense time of year for us, which is fine. And then for Marketplace, it begins November 1st and ends December 15th. So 45 days. I always tell everybody that I know, if you're calling me for a social reason, call in January. If you need help with health insurance, we haven't missed anybody yet in regards to like our response time might be a little bit slower. But I have always told people when we get to the end, if we do not have time for you, I will call you and let you know that you need to find another option. And so far, we have not had to do that. So
That's awesome.
Yeah, hopefully we'll keep that up this year.
Yeah, well, I'm sure you're loving the fact that none of this stuff is even out yet, and it's probably all going to change between now and then. So,
I mean, it's job security, I guess.
yeah, 100%.
Yeah. But yeah, I would love to have things
100%.
to be a little bit more settled than they are right now. It's definitely going to be a bit of a roller coaster. But we'll be here with the most current information that we have to communicate with you, whatever you need.
Are we anticipating any major changes to the Medicare plans, or are we just thinking some of the premiums / what did you call it? The
maximum out of pocket?
Yes. Thank you.
Absolutely.
I don't speak health insurance, Justine.
That's
okay. Why I got you.
I don't speak finances. People say things like Roth, and I'm like, I'm sorry, this is not a me conversation. Yes. So most notably for people specifically in our area, we had a plan exit, which was the U of M health plan. And they are exiting both on the Marketplace side and on the Medicare side. And it seems like every plan in Michigan has used that as an excuse to raise their deductibles and their maximum pockets.
Sure.
Now, like if you keep up with like Blue Cross in the news, they'll tell you that they're bleeding money, and the main reason that is happening is prescription drugs, because the cost of prescription drugs is so high. And there was a change that was made for 2025 where there's a split, but the health insurance company has to cap the cost of prescription drugs at a certain amount, and then they have to support a percentage of that. Okay. And so because that has become such a financial lift for them, there's a lot of things going up. With Medicare Advantage, the premiums, the amount that you pay per month, really haven't changed, it doesn't look like. But the deductibles, the maximum out of pockets, the formularies, the list of covered drugs is something that we're paying a lot of attention to this year, because one of the easiest ways to keep your costs down is to drop expensive prescriptions.
Yeah.
Now, they are required to have at least a certain number within each care category. So you can't just like drop insulins completely, but you can choose which companies that you participate with. Okay. And so we're anticipating a lot of change in that prescription drug market. So if there's anybody who is on anything expensive, then it's a good year to make sure that that's still covered.
Yeah. Sounds like it. With that being said, if we haven't proven it to our listeners, you need to get a hold of Justine and check out your plan because it's going to be a wild year, it sounds like. So with that, Justine, how do people get a hold of you?
Absolutely. So we use a group email inbox so that you don't have to figure out who you're supposed to be talking to. And that is health, HEALTH, at BeneGuides, BeneGuides.com. Benefits like Benny like benefits, so BeneGuides. Our office phone number is 517-939-1981. And I do want to make sure that I say that despite the fact that I'm the one that is probably the most social, the most out in the community, there are 6 people here. And so our Medicare team is primarily Lauren and Kylie, and our Marketplace team is primarily Liz and Andrea. And then if you have questions about small group coverage, really any group coverage, then Daniel is here as well for that. And then I do a little bit of everything. Yeah, we've got a whole team here behind you to help with whatever you need.
Love it. That's fantastic. And I can vouch for all of those people because I'm pretty sure at one time or another we've had clients work with each of them. So, and they've all come back with fantastic results and very thankful for the conversation. Even the ones that ended up sticking with whatever insurance they already had and didn't end up working with you guys, which I think is a huge benefit, and kudos to you of being able to evaluate somebody's coverage and say, keep doing what you're doing. That's what you should be doing.
Stay right where you are. Don't change anything.
Yeah, exactly, for sure. So with that, Justine, it has been a pleasure. I am so grateful for you and your team. I'm going to put all of your contact information in the show notes so our listeners have that, and hopefully they'll reach out. And then hopefully, once we get some updates on what's happening with some of the potential changes, we can get that information out to people as well. So thank you, and it's always a pleasure.
Always. Thanks for having me.
Thank you for joining us for another chat about your retirement and finances. Please hit that subscribe button. You can also contact us at srbadvisors.com or email us at info@srbadvisors.com. See you next time on Kitchen Table Finance.
This is a Zedia Media production.